Good morning, colleagues, and a very warm welcome to this joint webinar between PAHO and CANPA, the Caribbean Alliance of National Psychological Associations. My name is Elisa Prieto. I'm the NCD and Mental Health Advisor working at PAHO's Regional Coordination Program for the Caribbean based in Barbados. And I'm very pleased and happy to be moderating this session today and welcoming you. So we have a very nice session lined up for you today. The focus of today's session, which is the second of these series that we have launched in collaboration with CANPA, which started about a month ago, is going to be Stronger Together when we look, listen, and link. We're going to be taking advantage of these sessions to start by launching the second edition of our virtual self-learning course on psychological first aid, which is part of the resources that we offer through our PAHO Virtual Campus for Public Health. And then we're going to have a very interesting panel where we're hoping to share with you some experiences from countries in using PFA and applying the key principles of look, listen, and link. So without further ado, I'm going to start sharing my screen, and I'm going to hand over to our first two speakers who are going to be presenting about the virtual course. Claudina Cayetano, who is our mental health advisor based in Washington, DC, and Edgardo de Gracia, who is a specialist working for the Virtual Campus of Public Health. So if you just bear with me 1 minute, I'm going to start sharing my screen. And Claudina, in the meantime, if you want to take the floor, over to you.
Thank you very much, Elisa. Good morning to everyone, and thanks for taking time to join us this morning. I'm very pleased that we have this opportunity to work with our colleagues from CANPA and to launch this these materials, this course, the Psychological First Aid, and for short, we call it the PFA in disaster management. And as you noticed there in the launch, you said this is a collaboration also between PAHO and CDB. And last year we had this course, and that now it is, we have managed to update it so that it reflects the current situation. So we promise to make sure that this will be a very interactive launch. So I'm very pleased to be part of this launching. Next. So the agenda that we had prepared for you, we have it in 3 parts. The first part has to do with the wellness, with the objective of the session, and the second part will have our colleague from CANPA, Dr. Peter Weller, to be able to moderate the second discussion, hearing from some colleagues experiences from the field, and the third part will be questions from you regarding this. So I will not when we get to that, and I'm sure they will be able to introduce our panelists. So the next. So when we talk about PFA, disaster management, this is an interesting course. It's a self-learning course. It's a self-paced. So I will let you know how you can get to the campus and be able to register. But the important thing is that to understand who is our target audience. So psychological first aid is for humanitarian actors. It's for people who are volunteers, who are lay persons in the community, who may be in a position to support others after a crisis. It's very important to to know that you don't need to have a particular background. You don't need to be a psychologist or psychiatrist. You need to be a specialist to be able to take the course. On the contrary, the course will help you to provide support in a more humane manner. So this PFA came about, a few years ago. Before this, people who used to work, you may remember we used to do debriefing sessions, and that's no longer recommended. So after research, WHO had recommended that it's more traumatic, doesn't really help. When you do debriefing, the person who speaks the most are the one who would be maybe not necessarily, oh, they will be probably just explaining themselves or talking about things, but not necessarily be the one that will benefit. You have people who are more quiet, and so you will not be able to know who really needs help. But when it comes to PFA, it's different. It's a one-on-one. So what is the objective here is that the objective is to be able to help people to regain control after a disaster. So the objective of the course is to define what is PFA. It describes the the factors to consider in providing PFA in terms of, when, where. It discusses the process. It lists the actions. As you know, we've been talking about the principles of action, which are the look, listen, and link. Identify individuals with special needs, and then how do you apply it in different scenarios. At the same time, it's also very important to learn your limitations, because we want to make sure that, yes, you want to provide support, but you have to know what are your limitations, when to refer, when to recommend that the person may need to seek a more professional care. So that's definitely is considered in this course. Next. So what is PFA? So PFA, as I've mentioned before, describes a humane, supportive response to a human being who may be suffering, who may be going through a crisis and may need support. And so the principles of PFA is the look, listen, and link, the 3 L's. So here what we're looking for, what people are going to be learning is, how do you provide this practical care? How do you support without being pressuring people to speak, without being intrusive? And importantly, how do you support person, assessing their needs and concern? So here, that's the difference between, remember I mentioned to you about debriefing, and now we're talking about PFA, psychological first aid. Think about first aid. What do we do in first aid? And then this is the same thing what we're doing in psychological first aid. So here we're helping people to address their basic needs. So listen to them. We don't want to pressure them to talk. We want to be able to learn, how do you provide comfort to people? We want to be able to know, how do you connect them? How do you help them to connect to social services, to more support if it's needed? Here is protecting them without causing any harm. Next. So that's what PFA is. And so this new course, it's, as we say, it's a self-learning. At the end of the course, people will be able to get a certificate upon completion, and the certificate is signed by our director, Dr. Carissa Etienne. It's 12, we say it's 12 hours, but depending on how you're doing it, you may be able to do it within even less or more. Because it's self-paced, it gives you time to be able to do it at your own pace, no rush. You can actually go back and listen more to the scenarios, very interactive. So that's the course modality. Next. And how it has been designed. It has been designed for, we have 6 modules. So the first module is about understanding psychological first aid. What exactly is psychological first aid? The second module takes you through how to help responsibly, because that's what it is, that you want to be able to provide support without, as we say, in a responsible manner. And then the third module helps you to look at the process of providing PFA. And the fourth module is to know who is likely to need a special attention. Because remember here, we don't want to cause any harm. So it's good to know who are you going to be referring, who you may need more assistance, because, and here, if in providing responsible support, it's good to know what are your limitations. And then of course, importantly, is that before caring for others, there's also a module on caring for yourself and caring for your teamwork, caring for your colleagues. So the module 6 is actually putting it into practice, the skills that are required to be able to do that. So these are the modules that the PFA has. So as I said, 6 modules. So the next, for the next please. This next slide is talking about what is different. Remember we mentioned that last year, 2019, we launched the course, and now we made some adjustment. We have to make some adjustment precisely because it is, the situation that we are living. So this has been revised to reflect the special consideration. How do we utilize PFA in ways that are safe for both the person who is providing PFA and the person who is in distress, especially during the outbreak such as COVID pandemic. Remember the COVID pandemic, PFA, when we talk about PFA in the past, this was during the hurricane, so you can touch and you can be there with the person. We need to keep that into consideration when you're talking about PFA during the outbreak, because we also want to make sure that people stay healthy. We want to make sure that people adhere to the public health measures, keeping physical distancing. So it is very important that we made this revision and that this content then is incorporated. All the consideration for the COVID response is new and it's integrated across the 6 modules. Next. So the references that we use for the course, these are here. You have the psychological first aid. There's a manual to orient the field workers. There's another manual for the field workers. There's these references in terms of the operational consideration for mental health and psychosocial support, which was developed by the ISC, the interagency for this is the interagency. A lot of you know about the ISC because we have been talking about the interagency for the reference group for mental health and psychosocial support, the Interagency Standing Committee, and they had been the one developing the briefing note for MHPSS. So there is a guideline, and within that guideline, there is also the PFA, which is adjusted for the outbreak for COVID. Next. And you will be able to look at all these new materials. Importantly is that these PFAs also look, we're talking about, you probably heard of for a campaign, the communication campaign is Stronger Together, which actually uses the principles of PFA, look, listen, and link. And there you have the website, which is to connecting to feel safe, calm, and hopeful. So the Stronger Together slogan and all the communication materials that we have are being used even for this week, the Wellness Day and the Wellness Week in the Americas. So I encourage you to connect and listen to the campaign and be able to apply that. And now I'm going to pass and we're going to have another presenter. So it will be my colleague, the engineer, Dr. De Gracia. So thank you very much, Edgardo, for joining us, and the mic is yours.
Thank you, Claudina. Hi, I am Edgardo De Gracia. I work as a senior engineer in the virtual campus for public health. I am in charge of the technological infrastructure, cloud services, system information analysis, research and development, instructional design, and coordination of the technical team that works in PAHO's primary specialized cooperation tool. Today, I'm going to show you how to access the virtual campus and the course. Next slide. First, you need to have access to the main website, either through the direct link, campusvirtualsp.org, or by searching in a search engine such as Google or Bing. Next slide. Once you are on the website, the first step you should do is create an account. If you don't have one, or just log in if you have one. When you authenticate with your account, you access the area of self-learning and select the course as shown in the slide. I recommend you to read the information that appears and click on the button to access the course. Next slide. All the participants that complete all the activities of the course can download their certificate similar to this. And of course, if you need assistance, you can visit our help desk. Thanks and good job with this course.
Great, thanks so much, Claudina and Edgardo, for this introductory presentation. Thanks, Claudina, for reminding us about PFA, what's the target audience for PFA, who can provide PFA, what are the key principles, and how it can help us during these times of crisis. And thank you, Edgardo, also for walking us through the virtual campus so that our participants today can familiarize themselves and follow the steps to be able to join the course. So I think we're doing great with time. I thank you both for that. And now we're going to start the second part of today's webinar. As Claudina mentioned, we are going to be having a panel discussion sharing experiences from the field on how PFA can impact practice. So this session is going to be moderated by our colleague, Dr. Peter Weller, who's co-chair of CANPA's Disaster Mental Health Committee. And we are going to have three great panelists: Dr. Cassandra Alonso-Ash, focal point of the AIDS-borne diseases at the Ministry of Public Health in Guyana; Dr. Angela Gordon-Stair, who is a licensed professional counselor and head of psychosocial support unit working with Jamaica Red Cross; and Dr. Wendy Fernander, licensed clinical psychologist at Sandylands Rehabilitation Center from the Bahamas. So Peter, I hand over to you and have a great panel.
Morning, everyone. Are you hearing me?
Yes, good morning.
Hi, morning, everybody. Good to be with you. As usual, thanks, Elisa, Claudina, and Edgardo for your presentations. Set the stage for accessing what is such important resource material for us in these times. Now, we wanted to spend this second part and third part of the webinar looking at practical applications. So we welcome our panelists, and of course, I also want to welcome all the participants. I know everybody's very busy, under stress, and I think it's good that you've made time to be part of this forum. We have three panelists, as you've heard, and what we're hoping to do is to show how we can translate the concept of look, listen, and link into applying the psychological first aid methodology, using the course in real life. And so our three panelists are going to give us different perspectives. Our colleague from Guyana, Dr. Alonso-Ash, is going to share, as someone who's participated in the course, how it has been applied in her context. And it's interesting because if you saw her title, she's from the Vector Control Services. Not what you might think of automatically as psychosocial support. But as we will hear now, there are applications and implications we need to be looking at outside the box that some of us sometimes operate in. So can I invite Dr. Alonso-Ash to share with us, in the brief time that we have, could you begin with just saying how you experienced that course and how you've applied it?
Oh, no problem. A pleasant good morning, everyone.
Morning.
Morning.
I will introduce myself again. I am Dr. Cassandra Alonso, who's the focal point of the AIDS-borne disease program, Vector Control Services, Ministry of Public Health. But I also volunteer with the COVID-19 hotline. And for that, I've been exposed to the psychological first aid training that was held in July. With this, it was a very fruitful program. It was quite interesting. Why? Because you never really focus. For example, in module 5, it did say that a health worker or a normal person, because remember, the PF is not restricted to professionals. It can be anyone. But no one takes the time actually to take care of themselves. For example, we had a few weeks ago, we had a death of a medical personnel, a doctor, who died with COVID-19. But then when you did the retracing, he was focusing on his patient because he was a person was passionate about his work. And for that, he gave his all to his services, his work, but then never took the time to take care of him. And for this, I thank PAHO, and I also thank Ministry of Public Health, Mental Health Unit for having us, especially the persons at the COVID-19 hotline, to be a part of this training. In March, when COVID-19 came into, were introduced into Guyana, you had a lot of persons, or I think everyone, not just the community persons within the community, you had the health, where everyone was panicking because it's frightening when you're seeing in China the many deaths, you're seeing in United States of America thousands of deaths, and then you have a small country such as Guyana who just housed 750,000 approximately persons. And then to know that we're so small, and then we have our challenges with our health system, and then you're told that, you know, the kits are, or the testing, the PCR testing is limited, and the herd, because it was a new norm. You have to wear a mask, you have to wash your hand. So you had you had a lot of persons that were so scared after reading things from off of Facebook, as everyone looked on Facebook for information. They Google stuff, so you had a lot of persons calling, panicking. I can remember one young man who called early in the morning. I think I'm presenting shortness of breath, but he was speaking clearly, because as a doctor, there is always doctor at all the different timings of the day to answer questions, because we have volunteers who may not have the health background, so you have to have a doctor on call. So when, after assessing the patient, I asked them, you know, gently asking some questions. So what were you doing earlier? Have you been presenting fever, cough, no other symptoms but this shortness of breath? But he's speaking clearly. So I asked him, what you did this morning? He said he just came off the treadmill and now he's feeling shortness of breath. So this tells you, because remember you're reading, as I said, this was the beginning in March and April, people were panicking. So you had lots of persons were calling just to say they think they're presenting symptoms while they were not. So after being exposed to this training, I think it was quite, it helped us to deal and know how to, and not panic with the patient also, but also be calm, and so that we can keep the patients or persons calm, and kind of put them in a comfort zone. Yeah. So that was my
Well, great. It sounds from what you're saying that the PFA helped to kind of give a context and structure to what are natural and normal concerns that are not just the public, but we as practitioners and providers too, no matter what our educational level is, we need some support. And of course, as you emphasize, the self-care aspect. And just briefly before we listen to our next panelist, do you have any ideas about how this should be promoted further in Guyana and how it might be used, the psychological first aid course?
Well, I think after being exposed, because I think due to COVID-19, I think not much persons were given the opportunity to be a part of this training. So remember, we have school will be reopening soon. So I think the mental health unit is planning to also engage teachers, because teachers also panic. We've been noticing, because I've had meetings with them during the common entrance time, and then they're afraid to come out to me. They're happy for their kids, but then they're also afraid to come and to be exposed, because remember, they have to take the public transportation. So I think not just the health professionals, or not just the volunteers, should be exposed to these courses. You should have other persons, as I said, the teachers, the police, persons, like I also supervise the field officers who normally go to fog, but right now they're assisting with sanitizing buildings, sanitizing the compounds that house these positive cases. So I think they also should be, also involved in the PFA, which I'm planning to also provide training, because remember, I was exposed to them. I should further extend my knowledge to them.
Excellent.
Yeah.
Excellent.
So
Well, I think, sorry, go ahead.
yeah, sorry.
Now, I was going to say that I think you're making all the key points that we would want to promote, that here is a resource that's accessible. There are many who can benefit from it, not only because of their professional status, but as members of the community. And then, as you said from the beginning, because it's also a tool in self-care, that the information that's provided, the tips that are provided can be used personally as well to manage our own anxiety around all the issues that the pandemic is raising. So we want to thank you for sharing. And we look forward to hearing more about how the programs in Ghana evolve and perhaps some more feedback on how PFA is used there. Thanks again for your participation. I'm going to go with the next person on the list, Wendy Fernanda, next on the agenda from the Bahamas. And as you see, she's a licensed clinical psychologist based at Sandyland, as you heard, but really involved in as a focal point in pulling together the services that are provided in the Bahamas. So we're going to get a perspective now about how Look, Listen, and Link operates on the macro level of pulling different stakeholders together to ensure that efficient services are provided. So Wendy, are you on?
Yes, I am.
Great, good seeing you, Wendy. So, we only have a little time. So if you could just give us an overview, because you have a very excellent initiative and model, a standard operating plan, program, procedure that you've all been developing there. Can you share a little bit about that for us in the region?
Okay, so as this would have been last year. Last year, just about 4 weeks before Dorian hit the Bahamas and literally devastated 2 of our northern islands and our second and third economy, generating economy. I sat with Dr. Claudina Cayetano from PAHO, and we drafted our SOP for mental health for the country, for disaster mental health. And little did we recognize that it would be just, like I said, a couple of weeks later that we would have to use that. Now, what
you're referring to the hurricanes, of course.
Right, have to use that for the hurricane. So to where we are now, what we have found is that as we use the SOP to guide us, because that's really what it is, and it's a living, it's a live document, we found that as we went through using it, that there were a lot of challenges that we felt that we needed to address. Where we are now with COVID, we also found that it was useful, because I think for us, when we drafted it, when I took part in drafting it, I envisioned disasters as hurricane, because I know that we are in hurricane zone. So that was that was what I saw. And come fast forward to March, when our first case of COVID hit, and in fact, prior to that, just a few days prior to that, I had the opportunity to speak with the Ministry of Health staff, and to kind of advise them that with the plan for the public health response, that mental health needed to be an integral part of the response to COVID-19, because I knew that inevitably, we all knew that inevitably it was going to reach our shores. So I said that we needed to have mental health as an integral part of the response for the COVID-19.
So just to make sure that there's a point you're making, I think that's really important. So you had to advocate for the inclusion of mental health and psychosocial services as an integral part of programming. That was an important role that you had to play.
You were saying, Peter? Okay. So yeah, I didn't hear you. You were saying?
I was saying that I was just flagging that you had to be an advocate for the inclusion of mental health.
Absolutely. The thing is, and that's one of the things that I hope that we understand from our regional colleagues, is that you have to be the advocate. you cannot, even though we would like to think that we expect these persons who are in authority to recognize the importance of mental health, that usually is not the case. So you have to essentially be the advocate. You have to point out to them the importance. And as I said, recognizing that COVID is going to be here, and also realizing that what was said, what the studies show, the studies show from previous pandemic and epidemic, that mental health should be just as important as the public health response, or should be included.
So I think one of the key issues here also, or implications, is that a course like the PFA course that begins to unpack the different elements of mental health and psychosocial services in response to the existing needs is not only a model for programming and training, but it's also a model for advocacy. Because if you're trying to get people to look, listen, and learn, you have to know what are the key points to be made. And the PFA highlights that in a way. Can I just take you back? Because you talked about your SOP, but I think for those of us in the region who've never had to develop an SOP for mental health services and disasters, etc., can you just tell us a little bit more, only a minute or two, about what comprises a SOP? What are the key pillars or components of an SOP?
Okay, so the SOP allows us to, it allows us to look at how the mental health should be engaged in disaster, how mental health and psychosocial support should be engaged in disaster. Okay, so it lays the foundation, the groundwork. And then it also lays the foundation for how we are to essentially collaborate with other persons, with other mental health professionals, as well as INGOs and NGOs. Okay, so it gives us a clear guideline, sort of, as to how we are to interact, how we are to collaborate, how we are to coordinate our services. Now, what that SOP allowed us to do, and I think for us is interesting, is that we were able to take the SOP and not just when you think of disaster response well, for us in our country, it's usually led primarily and driven by the government system, okay, the Ministry of Health. But what happened was, immediately we recognized that in drafting this SOP, we included the Bahamas Psychological Association, as well as, of course, the Bahamas Doctors Association and the nurses and all of that. But we included the Bahamas Psychological Association. And so what that did was that gave us the drive, the impetus that we needed in order for us to get the work done. Because when the government service, which is limited in human resource, wasn't quite able to provide the full scope of service, the Bahamas Psychological Association, in collaboration with the Pan American Health Organization and the Ministry of Health, and of course, the Public Hospitals Authority, we were able to come together. And I'm sorry, it's gonna, I'm Sandilands, but I'm also BPA. So we were able to come together, pull a team together, and draw from expertise within our country that were not necessarily within the public sector. And also we were able to pull together persons who may have had associated skill set that allowed us to use them. We did a lot of PFA, we did training for those persons. Immediately after, we trained nurses, physicians, private sector persons, pastors, Creole speakers. I did a presentation last week for World Suicide Day. And one of the things I said to them is literally we participated in over 50 MHPSS kind of training for persons within the country, just to have people prepared and ready. So
excellent.
This, yeah.
Yeah, and we're kind of out of time, but I think there are a couple of points that I really want to flag. One is it was needs-based. You looked at what the needs were in terms of mental health and disaster. You identified the various stakeholders, did capacity building, but also built networks and partnerships that I think had particular relevance when there were a lot of external providers coming in, the Bahamas was able to have a Bahamian core group who could give feedback and guidance as well, which I think is really important. But as you said, it also set the stage for a response to the COVID pandemic. Already a team, a network, common objectives and goals. Excellent work, and I really hope that that SOP is something that we can use as a model in the region, even just to guide our conceptualization. We may not all have all the resources, but excellent work. So thank you very much, Wendy. Thank you. And I'm going to ask now Angela Gordon-Steer, our last panelist, also a licensed counseling psychologist from Jamaica. And Angela has been coordinating for years the Jamaica Red Cross Psychosocial Support Program. So we're going to invite Angela to share with us a bit about how the psychological first aid training can be used at the level of the community and some of the elements of the work that the Red Cross has done. Angela, are you with us?
Yes, I am, Peter.
Oh, welcome. So yes, in the 5 or 6 minutes that we have, if you could just share a bit about your program, how it has been modified, particularly because of the COVID pandemic, and any recommendations or implications you want to share.
Well, our mental health and psychosocial support team we are made up of psychologists, psychiatrists, other mental health professionals, and social workers. We have been in existence since 2001, and we have always had a community-based orientation. But what has happened over the years is that this response team, the PSS team has been, which is made up of professionals, has been the response and training arm of the Jamaica Red Cross. We've been involved in training throughout the Caribbean and Central America as well. But with COVID, and if you can say there is a silver lining to COVID, it has been that using the psychological first aid in the COVID-19 outbreak response for Red Cross and Red Crescent societies, which is a specific training that was developed within the Red Cross movement. We have focused PFA on training all staff and volunteers in the Jamaica Red Cross, because COVID has created a unique situation where we are not able to reach out physically in most instances. And even when we are physically present, people are in PPEs and all of that. So the focus of this has been on, this training is done online. The focus has been on emphasizing whatever you're going to do, to use a PFA lens. So if you're going out to do food distribution, you are using the skills you have learned through PFA, the look, listen, link, to assess what is happening with people beneficiaries who are on the ground. We have also emphasized using, digital devices to reach out, your phone, your WhatsApp, how you use that, and how you understand people's emotions through the written word. How do you pick up on what is happening there? How do you identify normal versus extreme responses to what is happening? And what the PSS team is now doing is, our response is now, again, in training, but also we have been doing focusing on doing psychoeducation to the wider population through radio and TV interviews. Things we're focused on is things like coping with loneliness, coping with stress, social distancing, coping with stress returning to work, managing children at home, that sort of thing. So for the wider Jamaican population, we have been doing that. So your professionals are more in that way. In terms of some of the lessons we have learned from this is that, one, internet and phone connectivity and availability is poor in some areas of the community. So you have to be aware of that. You may not be able to use that in all situations. It's a new way of doing training. Ours is not a self-taught course. Ours is one that we teach via Zoom or one of the other platforms. But what we've seen, it's cheaper than bringing people together in a hotel setting for a couple of hours. It's cheaper doing it this way, and it's proving to be just as effective. And because the Jamaica Red Cross is widely respected by the government, the Ministry of Health has reached out to us, the Mental Health Division has reached out to us to ask us to be involved in some of their training. They have facilitated us making referrals into their helplines, their mental health helplines. We have also made connections for referrals to this children's registry for child abuse cases that we may pick up, or gender-based violence cases we may pick up. There are specific hotlines for those. Pardon me. In terms of recommendations I would make to our partners throughout the Caribbean, use your experts to do training. Having something like psychological first aid available to you, use your experts to do training, to do outreach. And the other thing we have done is we have used them to support the volunteers and staff in terms of they're out there in the field, they're working, they're doing long hours, providing them with a place where they can decompress, deal with some of the issues that they are seeing. So your professionals are providing that service. So I'll stop there, Peter, if there are any more questions.
That's fine. That's great, Angela. And it's a good point to stop on, because it gets back to the networking. It speaks to how we need to support each other and how we need to take care of ourselves. I'm sure we'll engage with some of these issues as we open up for question and answers. But I think that it's good to know that the Red Cross has this program that's part of the Red Cross Red Crescent, and is training up community-based individuals, because I think that's one of the things that we have to understand, especially in the context of the pandemic. So thank you, Angela. And I'm going to wrap up now in terms of this section and open up for question and answers as guided by Lisa. Simply to say that when we talk about look, listen, and link, it is a concept that applies both to how we see ourselves and how we look and listen to what's happening with us as individuals, and link ourselves to the support we needed. But it's also true at the community level and at the macro level of the state or the government. We have to really facilitate the coordination, the collaboration, and the networking. And the psychological first aid course that PAHO has, and the other versions available, are critical tools that we all can use, as you have seen from these three panelists, in different ways. So Elisa, can I turn over to you to open up for the question and answer?
Sure, thank you so much, Peter, and thank you to our three panelists. I think it's been a very nice mix of experiences from different levels and different backgrounds. So thank you very much, and thanks for the excellent moderation, Peter, as usual. So now we are great with time. I think this is the first time we managed to keep on track with our agenda, which is great. We have 72 participants. So I'm hoping over the next 15 minutes, we can engage in a discussion with those who are connected. You can use either the chat or the Q&A. You can also raise your hand if you wish to take the mic. So please, the floor is open for any questions to our panelists, any follow-up, or if you want to hear more about any of those experiences, any questions to Claudina or to Edgardo about the virtual course. So open.
I think we have one question in the chat Elisa, asking about if PFA caters to the pandemic. And I'm not sure what others want to say, but I think that it is really important to realize that psychological first aid is critical for the pandemic, because stress and anxiety are, corollaries of this concern about exposure, etc. Whether you are trying to help people deal with anxiety of preventing, or you're trying to help people deal with the psychological stressors of being infected or having a family member who's infected. So psychological first aid is a critical part of the pandemic in many ways.
Sure, and just to add, Peter, and I think Claudina highlighted this, the second edition of the PFA self-learning course, the main change that it integrates is specifically recommendations for providing PFA in a safe way during the COVID-19 pandemic or any other infectious disease that requires certain public health measures and precautions. So definitely it applies, and it applies to any crisis situation. And that's one thing that I feel the PFA course at the start of the course in the initial modules tries to emphasize. Claudina, I don't know if you want to add, and there's an additional question that links to this. Can PFA be used as a school social worker? So Claudina, if you want to complement and maybe reinforce.
Definitely, no, and I think both of you, Peter and you, Elisa, had quite made the point that this is so the idea of revising it is because we want to make sure that it reflects the pandemic. And it's not just about COVID-19. I think we also had that conversation that it's not only for this pandemic. I mean, we probably will see other pandemics coming up, so we need to be able to be prepared and adjust to that. So I like the fact, I was interested to listen to the conversation from, what Angela and Wendy and Cassandra has to say about how that they are using it in their country. So here again, I liked when Angela made the point that even for people that distributing food, how do you use that? How do you use that skill to be able to do that? So definitely teachers, definitely religious leaders, definitely people who are in contact with people. The idea is that we are being more sensitive and more, supportive to our colleagues or neighbors or people who are experiencing crisis. Thank you.
Great, Angela, I see you raising your hand. Do you wish to?
Yes, just to say that the program we do in the Red Cross, and I'm sure the one you do with PAHO, emphasizes, that the learners learn something about whatever epidemic or pandemic that you're faced with. What are some of the signs, symptoms? What are the referral points? Where do you refer, and how do you get further information? So that, and most importantly, how do you keep safe as part of your self-care component?
Sure, thanks so much, Angela, for emphasizing that. And that's a key piece of the look, right? Entry, crisis situation in a safe way, safety first, always. So thanks for making that point. We have another.
And if I could just add quickly, and I think what has come up, and I just think we should flag, is that PFA is a way of being present and available to understand what is going on and what is needed. It is not meaning that you must provide everything that is needed. So the link is really speaking about linking individuals to the service providers and entities who can give them what they need. That's one of the reasons why the SOP in the Bahamas is so important as a model. We need to know who else can provide service. So PFA can be used by anybody because its focus is on identifying the needs and identifying who can meet those needs, and then making a referral. If you are a psychologist or a counselor or a pastor and you have certain skills, social worker, then you might be able to meet those needs. But the focus is not on you being able to solve the problems in the grand scale. The focus is on you being able to help the person get what they need. And I think that makes it relevant across the board, and it emphasizes the need for us all to collaborate.
So, and I wanted to add to that, that you mentioned, Peter, because I think the case of Bahamas, and Wendy made it very, very clear, because she was really advocate. So you need that advocate to say, how do we do that? So that collaboration also can happen in other countries. And I think her intervention was very clear in terms of how can it be done in terms of bringing other stakeholders when you're going to link, and where do you do the linkage. Thank you.
Excellent. Thank you both for those additional comments. And we have another question, which is a very interesting one. Can someone comment on the usage of COVID hotlines and how are they integrated into existing hotlines or standalone? So I don't know if any of our panelists or Claudina wants to take up this question.
So I will start, and then I'll have opportunity for Dr. Alonso. That's how I met Dr. Alonso, actually. From Guyana. So our office in Guyana, through the support of Karen Roberts, we developed this training for the COVID hotlines operators. And because we already have PFA, that was one of the first requests. And then that's how I got to meet Dr. Alonso, actually. And I was interested, you know, when I listened to her experience, that she works with vector control, totally different. So we did the training for the hotlines operator, and they were required to take the course and then, you know, present their certificate, and then we had a discussion. So it would be good to hear from her how that can be used. Because remember the principles of yes, look, listen. So hotlines operator can definitely benefit from the listening, from the communication skills that is there. And then at the same time, also taking care of themselves, because they work very long hours, and some of them, and they have, you know, they have families, so all these things. So I think it's very important that, yes, this definitely applies to be able to be used by hotline operators. But maybe Dr. Alonso, you may want to add some more to that. Thank you.
Thank you, Dr. Claudina. Yes, I would like to add that one, that the COVID hotlines are not integrated to existing hotlines. I think they came about after COVID-19. So this is our new hotline, because of this, we were given the opportunity to work with, I don't know if they have call fund in other countries, so that so until then we actually have this, because you have a hotlines like for domestic violence, for suicide, but they are not linked. And because of the PFA, we got the understanding that we can now collaborate with other hotlines, because we've been having, I can remember earlier also, I had a call from a young man who was shot in the past, and his mom called to say, I think she wanted him to have some attention to go to the hospital. So she used the symptoms of COVID-19 so that we can get the ambulance and get him right away. But when I chat with him, as you said, I listened to him. The thing is, at that time, after he was shot, his wife left him. He wasn't able to eat well, and so he felt like giving up. He felt like he has no existence because his wife doesn't want to be with him anymore. She left him on his own to take care of himself, although he has his mom, but he needed, his wife to be with him. And so you had to, with this, as I said, with the PFA, it helped me to speak to him and to tell him not to give up. And it's important. We have, sometimes some persons kind of frustrate you at the hotline, but then it's important, not just before this whole COVID-19, as a medical practitioner, when you're seeing a patient, it's very, very important to listen to a patient. I can remember another person who said she went to many doctors, but I was the first to actually listen and pay attention, not just write a prescription, not just send her off. But
yes.
you have to really listen to persons, because sometimes they need advice. Sometimes you just need sometimes you just need a second opinion. Do you think I should go to this other job? Do you think I would benefit? And you just, you know what? I think you should, because you have the qualification. You just need something. You just need someone to listen to you. So I think
Thank you so much.
yes.
Thanks, Cassandra, and thanks so much for sharing your experience. So we have quite a few other questions. One of them is the course applicable to be used in an organization's employee assistance program. I joined the session late. Can you provide info on the course and when it will be offered, please? So I'll respond to part of this question and then I'll let others complement. So the course is available in the PAHO Virtual Campus of Public Health. We'll be sharing the presentations after this session, which includes the link to the PAHO Virtual Campus of Public Health, or as our colleague mentioned, you can just Google it and it will come up. And if you go to the self-learning course menu, you will find there this PFA course, which is free and you can enroll anytime. It's free of cost and self-paced. And maybe here I will ask Claudina to comment a little bit on how the PFA self-learning course is being used for training. I think Angela mentioned before that the modality of training that the Red Cross uses is face-to-face, and we have been using the virtual campus course as a first step to complement other forms of training. So maybe I will let Claudina, and just before I hand over to you, Claudina, let me maybe read a couple more questions so we can take them in a batch. So there's another question. Recently, we have been having an individual dying by committing suicide. How can PFA be used to meet the affected families? And then there's another question. Are the courses for specific populations like children and adolescents? My observation is sometimes PFA appears to be more average adult specific, but populations like children, differently abled, visually impaired, deaf, etc., some methods may not apply. What support is available for training? So I'll stop there and hand over. Maybe you can start, Claudina, and please, I can see Angela, you've already raised your hand. If others want to jump in after her, just raise your hand.
Just a quick clarification, Elisa. We do our training virtually.
Yeah. Sorry,
But
I face-to-face modality that
virtually.
Yeah.
Okay, thank
Sorry
you.
for that.
No, so this is great. I know we almost over time. So in terms of the first question about, you know, I'm going from the last one about children and adolescents and observation that is more, this is what is, I really like the collaboration also with CANPA in terms of having, how do we utilize it at the country national level? So this is why this discussion, how other countries have utilized this, because so in terms of, there's a module 4 that says people who likely need a special attention. So children are considered there that will need it. Adolescents are special attention. All people with mental health conditions, people with physical condition that may require more help. So yes, there is consideration, and this is why it's good for you to know what are the resources in your country where you'll be able to do the referrals. Because, and some people may not want to go to the psychiatrist, but there is a psychologist that's available. So it's good to know what are these resources. So that is one. It is even for people with disabilities. So that is another. When we used to do it face-to-face, we used to have role plays about these kind of issues that, you know, children with disabilities, people with disabilities, and what do you do in this situation? And what do you do in situation of violence? So all of those are considered in the course, because we are not expecting you're going to do everything. And Peter said that very clearly. We don't want you to do everything. That is why you can refer. That's one. The other one was in terms of how do you utilize the course. I think the other one, well, how we utilize this course with, what was the other one?
With an organization, I think.
Within an organization. So one of the things that we are encouraging, you can, I mean, you can do it on your own, but I think it's important if you understand your resources, like what's happening what is happening in Jamaica, what's happening in the Bahamas and in Guyana, that after taking the course, that there's that discussion, that conversation of you're learning what was important, what was relevant, and how can you utilize that, and how can you pass it to others. So the recommendation is not to do it alone. It's not, I mean, you can do it alone, but it's always good to have that support system that helps you to continue working within that same network. Probably I stop here because of the interest of time, and I know that my colleagues may want to add something to the other questions. Thank you.
Peter, you want to go ahead?
Actually, if there are other questions, maybe you can go through those first and I'll just integrate my comment in the
No, we don't have any additional questions for now.
Okay. Well, in the meantime,
so
I would just share. Okay. Just to pick up on a couple of points, I think one of the issues that was raised about hotlines, and I think it was mentioned in the end, that we have existing hotlines and then we have new services being developed. But I think one of the things that those of us who understand mental health and psychosocial services and needs is to advocate for integration. Because if we're going to have any sustainability of these services, we cannot have all of these parallel resource consuming systems that have so much overlap. So I think that point about how we can ensure that pandemic-related hotlines are integrated into stress management hotlines and GBV hotlines, et cetera, at least in terms of cross-training, so that people who call GBV, but the issue has something to do with COVID, the hotline providers at the gender-based hotline can address these issues. And again, that's one of the reasons why it's so important to us at CANPA, which is the Alliance of National Psychological Associations, is to try to ensure that the psychologists and the mental health professionals in country are playing this role, not only of capacity building, but advocacy. To do with the training and the self-learning, just an idea that has been used in other places. You can do these courses on your own, in your own time. You just need to go online, sign up, and you can do it module by module, as many as you want. But in terms of developing teams, and I think this is what Dr. Caetano was saying, if there's any way that in your team, you can do it independently, but then have time to discuss. So maybe you and your colleagues could agree, okay, between now and next week, we're going to look at modules 1, 2, and 3. And then in our staff meeting or whatever context, we can talk about what came up in modules 1, 2, and 3, and we can kind of pull things together and look at implications for our work. So there are many different ways to use a resource like this, both at the individual level as a training tool, but also as a kind of collegial, ongoing professional development, so to speak. So I really want to encourage you to all our participants to at least familiarize yourself with the course. Go online, look at it, look at the modules, and share it, and as appropriate, use it yourself. Over.
Thanks so much, Peter, for that comment. And I think, yeah, one good experience that we are having with colleagues in countries, how this course, as Paulina mentioned before, is the first step in some cases to have a follow-up, and yeah, no, it's definitely one piece, no? So I don't know if there are any additional questions. Oh yes, we have one. How can, and maybe this will be the last question we take, as it's already 11, so we need to start wrapping up. How can organizations, ministries harness the skills of psychological first aiders who have accessed the virtual course through PAHO website? Is there a list of persons who have been trained that is disseminated and can be made available? So Claudina, do you want to comment on this?
Yes, thank you. Again, I think Peter made it very clear in terms of how can organizations, so it's free, it's available on the website. Edgardo put there the website how you access the course, so you can do it at any time. And I think the idea of doing it by organizations is that you let your colleagues know that this is available, and you go module by module. There is 6 modules, so over like a period of 6 weeks, you can each, have access to module 1, do the module, have a discussion. That's something you can do at your own time, So I think I like that idea, and then how you utilize that. So organizations have access to that, ministries have access to that, and the experience from Guyana, as I mentioned, is because we had this training, this webinar series. So we wanted them to do the training first and then have the meeting to have a discussions about, so before the training, after the training, each one of the person that had completed the training sent their certificates to the mental health program, to the director. So we knew that they had completed it because they received their certificate, and then they had a list of who are the people that have completed. For us as PAHO, of course, that's very important to know who have done that, but I think I take what Peter was saying, it's very important for the country to know how that information is utilized. Where are the people who have been trained? It's definitely very important because they are the one within that, working together to be able to utilize the training. So it's because the course is free, so it's easier to access that. But more importantly, how are you utilizing it to make sure that it is benefiting the people who are on the ground? That's what we want. We're working to make sure that it's utilized at the ground level. So I think the questions about, giving you ideas of how you can utilize that, getting together with your group is fabulous to do. That was what Guyana did, and I'm sure can be done with the Ministry of Education, with lay ministers. It can be done in many settings. So time is going. So I'll stop here. Thank you.
Thank you so much. So we're going to start wrapping up. And this is something that I had not asked panelists to prepare, but I'm going to put them on the spot. For wrapping up, I would like to ask you to take the mic and just in 1 minute, really brief, give us a key message, a take away message from today's session and from your intervention in the panel. So one key thing about PFA, the look, listen, and link that you think it's critical for our participants to take with them. So, and again, I'm putting them on the spot because I hadn't asked them to prepare. So maybe I'll start with Peter to give our colleagues a few minutes to recap.
All right, so I'll actually begin with one quick comment. The last question had also wanted to know about how to find the people who have done this training. And I think that's a challenging question because it's a self-accessed training, so it does not necessarily list who has done it. And I think that's something that we do have to look at and maybe in each country try to develop a way of identifying who have done the PFA training, if they've done it by themselves or not as a part of a program. So that's something to look at and consider as we go forward. I think that for me, look, listen, and link is a conceptual frame that is very important because it emphasizes needs-based, it emphasizes collecting data, evidence, and then it emphasizes service and collaboration and coordination. And I think those are the kinds of messages that we want to take away. There are certain skills that you need to have if you're going to understand what somebody needs at the time of a disaster or during a pandemic. But then that has to generate some kind of level of intervention, either for the individual or at the larger community or national level. And I think if we all collaborate and have this kind of conceptual frame, it will mean that we work more closely together, which means we support each other, which means we take care of each other. But it also means that we provide the services that are needed. So I really want to encourage everyone to buy into this concept of look, listen, and link. That psychological first aid is not something that is a specialty for professionals, but a set of skills that anybody can use in a time of crisis, and that there are resources that can allow us all to train up in terms of building these capacities. So those would be my closing comments. Oh, and I should also say, of course, that the Caribbean Alliance of National Psychological Associations, with the emphasis on national, is trying to work in each country to identify the psychologists and other mental health practitioners who can become part of a core team who are available to do, as Angela said, which is build capacity, but also provide services as needed. So we look forward to partnering and collaborating, not just with PAHO, but at the country level with those who are involved in mental health and psychosocial services. Thank you.
Great, thanks, Peter. So Claudina, very, very brief.
I think for me, it's caring for yourself. Before you care for others, take time to take care of yourself.
Great, thanks. I love how short and sweet. Angela, do you want to go next?
I think for me, it is that when all is said and done and all the experts have left, the community is still there, and we need to build that capacity within the community to be able to take care of themselves. They have the ability, they just need the skills.
I love that empowerment message. Thank you, Angela. Wendy, do you want to go now?
Yes, I so agree, because that's one of the things that I was thinking about, particularly as our country is an archipelago and it's scattered on the islands. And so for us, building capacity, and that's how the look, listen, and link is so important for us. We see that as us building capacity, being able to provide some kind of psychosocial, mostly concentrated on the island of New Providence. So that's very important.
Wonderful. Thank you, Wendy. Cassandra, over to you.
Yes. So I agree with everyone. I think that everyone should be exposed to the training. Again, it's not just for professionals. It helps with dealing with crisis events. I know right now it's COVID-19, but then you have other events such as fires, hurricane, you have other diseases. And so I think everyone should get the opportunity to be exposed, again, not just professionals, but also persons within the community.
Great, thank you so much. I think I did great with putting you on the spot. You did a wonderful summary of the key points that we have touched on today. So I want to end by encouraging you to visit the virtual campus of public health. In addition to this course, there are many other courses. There's a COVID-19 dedicated space with a compilation of all the webinars that PAHO is doing, and that includes MHPSS related webinars, webinars on topics that you might find of interest, such as substance use disorders, violence, so many, there are many connections to other things, and it's a very rich resource. So I encourage you to check that out. I also encourage you to watch out for our next session, which will be most likely in about a month. So watch out for that. This is a series, so we're going to continue having this conversation and building on what we have discussed today. I thank you for your participation, your engagement, and as usual, I will be sending out an email with a recording of the session so you can share with colleagues who were not able to join us today, as well as the PowerPoint presentation that Claudina and Edgardo used, so you can have access to all the links and all the information. So have a great rest of the day, a great weekend, and please keep safe and healthy.
Thank you.
Thank you, Lisa.
Same to you.
Bye.
Thank you. Bye-bye.
Everybody keep safe. Bye now.
Same to you.
Alonso.